it started with fever, and we treated the fever. Through the fever, cough starts. So all those times we are going to clinic, negative, until history tell me that the thing want to form like TB. I should treat it. So that is why I am here.
Tuberculosis is an infection caused by a special kind of bacteria. It causes most commonly a disease in the lungs, which is some form of pneumonia.
Nigeria is a high-burdened country for tuberculosis, also known as TB, drug-resistant tuberculosis, DRTB, and HIV-associated tuberculosis. In 2014, Nigeria ranked 4th among 22 countries with highest incidence of TB in the world and 1st among countries in Africa with an estimated 570,000 new cases each year.
Sabida ban gane tari bane a jikina. Farko da shakuwa ya fara. Muka je muka yi ta yin maganin gargajiya.
Kafin mu zo nan asibitin mun fidda tsammani kaman ba zai rayu ba, kuma mun zo asibitin nan an taimake mu kaman yanda ya dace, an ba mu kula, don kafin mu kawo shi nan baya iya tafiya, baya iya motsi, ga numfashin shi sama.
Amma yanzu zan iya miƙewa ne tafiya, in fita waje in dawo, in je bayi, in dawo.
Tuberculosis is a chronic infectious disease that is caused by a bacteria, or a bacterium we called a Mycobacterium tuberculosis.
It's also an airborne disease that infects people, everybody, a child that is even born today, to the oldest person.
Mojobo kiki ọmọ ọdún méjì. Mo ṣe notice ni pé ìgbà tó fọmú sílẹ̀ kò lè jẹun. So mo ra food fún complan. So bó ṣe ń jẹ still náà kò develop. Ó ti ń rá tẹ́lẹ̀ but ó yá ó jókòó kò lè dá nǹkan kan ṣe mọ́. Mo fi wá discover tó fi gbé wá síbí báyìí.
It's an airborne disease that affects the lungs. It can also affect other parts of the body. And when it affects other parts of the body, we'll say it is an extrapulmonary TB. But if it affects the lung, we say it is a pulmonary TB. So in other words, we have two types of TB, the pulmonary TB and the extrapulmonary TB.
Of course, the one that causes threat a lot is the pulmonary, where people cough and so releases the causative agent into the air and so become infective. But when we look at other parameters, we have other types, as it were, in terms of the laboratory tests.
The first step that we do when patients come to the laboratory for TB diagnosis is to give them a specimen cup into which they are going to produce an early morning sample and a spot sample, and they bring it to the lab. Then we take it to the lab, register with a form, we register it, we do smearing by oral staining, then we examine under the fluorescent microscope. Then we also take samples for diagnosis using the gene expert machine. That we work upon in the lab for the first 20 minutes manually, then we take it to the machine, which now run it for 2 hours uninterrupted automatically in the machine.
Tuberculosis germs are spread mainly through the air when people who are sick with TB disease of the lungs cough, sneeze, or spit.
Tí mo pàdé ní ìbàyí tí mo bá mi bá nígbà tí mo kọ́ wa wọ́n attend sí mi dáadáa, wọ́n dẹ̀ sọ fún mi pé ibi tó bá yẹn tó bá ti jẹ́ pé kí n má jẹ́ kí èèyàn jẹ́ pé kí n má jẹ́ kó tutọ́ sílẹ̀ débi pé ẹni tó bá fi wúkọ́ pé kí n má faṣọ bò lẹ́nu.
After the first coming, they will do the sputum test. So, and after all those things, if they are positive case, we ask them to go to the DOT.
DOT, it's an acronym or abbreviation for Directly Observed Therapy Short Course. And in this clinic, we identify patients who have tuberculosis, and we carry out investigations on them, and then we treat them for tuberculosis. They will be observed directly by the nurses taking their drugs. It's important that they take their drugs so they don't have or develop resistance after some time at the end of the day, because when they develop resistance, it's a more serious public health problem for members of the society or for the community.
When a person is infected with TB germs, the germs can remain in the body in an inactive state, that is, without causing sickness. However, if the germs become active, they multiply and destroy body tissues, and the person becomes sick with TB signs and symptoms.
So méjèèjì yìí ibẹ̀ náà ti máa ń mọ̀ ẹ wọ́n lóògùn fílẹ̀ mọ́ òògùn ikọ́ ọ̀fẹ́ tàbí òògùn tí dókítà bá kọ fún wa òògùn ikọ́ ọ̀fẹ́ kò bá àgbo kò bá tewétegbò ẹ tó bá fẹ́ fèsì tewétegbò.
The nature of my work is to see the patients that wants to see doctor there in orderly manner. Then I normally give them health talk, the cough etiquette. If a patient is being registered as a positive to the TB, I normally ask the patient to bring his or her relative. I will give them some tricks, what to do and what not to do. So it's the parents that he or she brought that will help me to monitor him.
TB can be treated. So far, the patients, they are cooperating with the doctors and the nurses. Like if they are taking their treatment as it's supposed to be taken, that they do not abscond.
You know, our community, we do a lot of traditional treatments. We do a lot of self-medication. So most times when people start coughing, they go first to the chemist, or they tell you they want to treat it traditionally, you know, until it gets worse, and then they now present at the hospital.
The challenges facing the fight against TB in Nigeria are, among others, the fact that cough is acceptable in the society, which has led to low case notification, and because Nigerians are not even aware of the silent killer itself, tuberculosis.
What do I know about TB? TB is tuberculosis. It's this very serious cough, you know, that makes a very horrible sound.
TB, TB, I don't really know. If it's TB, it's TB Joshua now, right?
I think tuberculosis is associated with constant and excessive continuous coughing, and it's something that has to do with a disease that is spread through the air, a communicable disease actually.
It's rare to just see people who come in from the community to say, I just want to test for TB.
The symptoms are simple, just cough, for up to about 2 weeks and above. You could have weight loss, there's fever, there's night sweats, somebody who sweats in the night. Those are about the basic symptoms of tuberculosis.
Tuberculosis is really treatable because the drugs are always available, accessible. We are not charging anything to our patients, so they can easily get access to the drugs and be properly treated.
In TB drugs, we have what we call 4FDC, which is a combination of 4 drugs. We have rifampicin, we have isoniazid, we have pyrazinamide, and then we have ethambutols.
Those against say nay. The nays have it.
The Nigerian government, through the National Tuberculosis and Leprosy Control Program, has set up over 5,700 delivery points across the country to ensure that no Nigerian die of tuberculosis.
What we do here is to coordinate the activity of our partners who are working to control the 3 diseases. TB, tuberculosis, leprosy, and Burundi ulcer. And we are also using support from Global Fund and other partners like USAID, KNCV to carry out most of these activities in Nigeria.
The major challenges with tuberculosis control in Nigeria over the last years has been the low case finding and low notification of tuberculosis in Nigeria. Nigeria is ranked among the highest burden countries with tuberculosis in the world. Actually, Nigeria is ranked 4th among 22 high burden countries in the world, and we are ranked 1st actually in Africa.
We say multi-drug resistant TB, we actually basically are referring to resistance to isoniazid and rifampicin, some 2 drugs that we use occurring at the same time, even though there may be some resistance to some drugs that we use for the treatment of TB, but when we have 2 of those resistances occurring, even though others exist, you refer to it as multi-drug resistant TB.
From 2015, August, I started the treatment from our place. So after 6 months, correct to drink the tablet 6 months, and according to the bounce up, they sent on to this place. So I started staying here, doing their treatment.
I took the drugs about 6 or 7 months. After 2 months, they would take me to test to their lab and test. They said I'm responding. Another 2 months again, they took me to the lab again, said I'm responding. And when the final test, they said that they don't understand my result. I said, how? They said, okay, that Mr. Man, the TB resists the drugs they are giving me.
Though they are now doing much better, they will still have to continue treatment, not only for their own survival, but also to avoid spreading the disease to others.
What they advised me, they said that my children that are living with me and my wife, I should bring them for tests. But then I contacted it. I said, okay, I will do that. And I brought my wife there. I took my wife there. I have two kids that are living with me. The last one, I second to the last, because they were there with me. So I took them. Sometimes they cough too. So I took them. I told them that sometimes they cough. I give them Septrin or Batrimambia, and they were okay. So when they test them, they were okay also.
So what we normally do, we ask them to do gene expert. It's the gene expert that we confirmed these people, they are really multi-drug resistant patients.
We've introduced a new novel machine, Gene Expert,
And currently, we have about 205 gene expert locations in the country where we can make the diagnosis within a short time. And the gene expert machine is more sensitive than the regular machine. In addition to that, we have about 5,700 locations in the country where we can treat TB. And so we are quite committed to getting this done.
Gene expert is a new technology of detecting TB using molecular techniques. It's a real-time PCR. Apart from that one, then we now sent also their sputum samples to the culture lab where we do the DST, where we find out which of the drugs are they resistant to. Then also we send them to PCR lab. PCR lab is a molecular test that we undergo for them, where we call them polymerase chain reaction.
This is where we do our smearing of our TB sputum samples. As you can see, it's just making the smear.
After doing all the processes in the biosafety cabinet, you add the diluent in here and then put it on top on the machine. Then the machine will process, and then at the end of the day, your result will be displayed on the computer screen, where it will show you, as you can see here, it's showing us MTB is detected, but the rifampicin also too is what? Is not detected. But where we have resistance to that rifampicin, which is the drug, the machine will also show us that yes, the sample of this patient is TB positive and also is resistant to rifampicin.
Multi-drug resistant TB, MDR-TB, and extensively drug-resistant TB, XDR-TB, both take substantially longer time to treat than ordinary TB.
Once they are diagnosed as multi-drug resistance, we commence them on treatment, and the treatment runs for 2 years. They will spend 8 months in the ward. Thereby, they will be given drugs and injection.
We have first-line drugs and we have second-line drugs. So when they are resistant for first-line drug, we do DST for them so that we'll be able to know which of the drugs are they resistant to and which of the drugs are they sensitive to. And when we have gotten that, again, if we're suspecting a resistance to the second-line drugs, those same patients too will be subjected to a test which we call the second-line DST.
Drug-resistant TB is even more difficult to treat. So, but we are making the treatment is still free. The diagnosis is also free, and we have so many centers that we are currently treating those who have drug-resistant TB.
On that area, we are helping the Nigerian government in ensuring that these patients don't have to be hospitalized for those number of months. So we are building community structures where patients will take their treatment while at home, but they can get a whole community structure using community nurses and community healthcare workers. And we think with this form of decentralization, we might be able to get significant amount of enrollment into care.
While patients with MDR-TB may be as infectious as those with ordinary TB, the chances of a TB infection being XDR-TB is lower due to the rarity of the condition. The measures to be taken are the same as those for the prevention of ordinary TB.
People don't take or don't easily accept the fact that they have TB. So we need to do a lot of counseling.
The risk of becoming infected with TB is very low outdoors or in the open air. TB patients should be encouraged to follow good cough hygiene.
Of handkerchiefs, clean handkerchiefs to cover the mouth whenever they cough, and then having buildings that gives good ventilation for air, to move freely. One very important means of prevention is to get those who have the disease quickly. You treat and cure them. With that, you would have stopped the cycle, of the disease.
are always trying to be very close to our patients so that contraindications, adverse drug reaction can be well managed. But the one that poses the greatest challenge is HIV and TB co-infections, because it impacts so negatively on the patient's quality of life.
Nigeria, the most populous nation in Africa, is fighting an immense battle in silence with two deadly diseases that have joined forces to infect over 100,000 lives each year: HIV/AIDS and TB.
So if the person is diagnosed at the same time of HIV and TB co-infections, in order to save the patient from undue load of drugs, we first commence the patient on tuberculosis treatment. After the patient have completed the intensive phase of 2 months, then the HIV treatment will then be brought in.
The most important confounding factor is HIV/AIDS. HIV/AIDS suppresses the body immunity, and the TB that maybe would have been there in your system for many years without doing anything would now spring up. And so we have more of TB cases among those who are living with HIV/AIDS.
The National TB Control Programs is working with all healthcare service providers to raise awareness about TB and prevent drug resistance to TB by ensuring that all practitioners working with people with TB adhere to the international standards for TB care.
A survey has been carried out by this CAP, Knowledge, Attitude and Practice, to know how many Nigerians are aware of TB. You'll be surprised that most Nigerians are not aware of tuberculosis. They sometimes attribute tuberculosis to poison or witchcraft, and that's the reason you see most of them who are coughing going to religious houses or taking traditional medicine. So the awareness is very low, and that's the reason we still have, out of the 600,000 cases that we're supposed to have in Nigeria, we are struggling to diagnose only 100,000.
KNCV Tuberculosis Foundation has been working for the past 9 years to eliminate TB in Nigeria.
No one should die of tuberculosis in Nigeria because the diagnosis is free. The treatment is also free, thanks to USAID and thanks to Global Fund. Through the Federal Ministry of Health, with the support of all the partners, there are over 5,700 service delivery points that people can go. There is no single local government area in Nigeria that has no TB service delivery point. There are also over 1,700 diagnostic facilities across the country. TB is treatable, TB is curable, the treatment and the tests are free, and therefore no one should die of tuberculosis and no one should pay a huge price for tuberculosis in Nigeria.
One thing remains clear: all forms of tuberculosis are treatable and curable.
TB patients will get free treatment in this country. We are committed to looking after them, and advise that anybody with fever lasting more than 2 weeks, sweating, coughing, especially when you are coughing out blood, you should let us know. Or if you are losing weight, let us know. It might be TB.
Once you cough for 2 or 3 weeks, or less than 2 weeks, please don't wait. You have to come out, get to one of the nearest DOT center. You'll be tested. If you have TB, you'll be treated. The treatment is free. So it's not for Nigerians to, our target is to eradicate TB in Nigeria, and it's possible.
Get tested today. Get treatment for free. And let's stop tuberculosis, TB, in Nigeria.
My name is Dosumolu Afunke. I'm a TB survivor. The first time I had TB, I was afraid because of ignorance, but now I'm LD. If you are coughing for more than 2 weeks, please go to the nearest hospital. get tested, and enroll for the treatment. The treatment is absolutely free.
For more information, please call tuberculosis toll-free lines on 0800 225 5282. Again, 0800 225 5282. That is 0800 CALL-CTB.